Hello to all. So welcome back to YouTube channel MEDICO'Z Factory. So we are going to start a new subject, that is general surgery, and one of the topic termed hernia is already started in the previous section. So you can follow that series, as well as the new topic which we are going to study today is shock, which is associated with the general surgery. So in case of doubt, you can use the comment section and do subscribe the channel for such content, and the content provided here is free of cost, so utilize it, share with your friends, and whatever the content provided here you can use for your university exams as well as your competitive exams. Clear? So let's begin. Shock. So we'll start with the definition. First of all, a basic definition that what is a shock. So shock is defined as a state of cellular and tissue hypoxia. There is a low level of oxygen with either reduced oxygen delivery or poor oxygen utilization, or increased oxygen consumption with circulatory failure or collapse, and poor perfusion. The definition has multiple terms which itself defines this clearly. One is the reduced oxygen or poor oxygen utilization, or either increased oxygen consumption due to collapse. What is it? It can be cardiomyopathy, heart failure, whatever the condition, or poor perfusion. That will be the decreased passage of fluid to the organ or tissue. This is the definition of shock. Now, normal aerobic metabolism is not maintained, and due to hypoperfusion, as there is the reduced amount of blood flow, ischemia, hypoperfusion, due to which a normal metabolism is not maintained, aerobolic. And shock is meant by inadequate perfusion to maintain the normal organic function, because the blood flow is reduced. That's why. It may be initially reversible. So if it is at starting stage, you can reverse it, but it becomes irreversible eventually if it is not treated, leading to multi-organ failure or death. Till condition is reversible, it is okay, you can reverse it. But when it turns into irreversible, it leads to multi-organ failure. Clear? Next, the types of shock. It can be hypovolemic, which is a 16% normal shock found. Then cariogenic, also 16%. Distributive or septic shock is seen higher, there 62%. Neurogenic or anaphylactic shock, which is said 4%, due to acute adrenal insufficiency, because there is a low level of cortisol. Or obstructive 2%, or endocrine shock, which is like hypothyroidism, thyrotoxic crisis, or adrenal insufficiency. Now, at cellular level hypoxia, when there is a low level oxygen, it can cause normal aerobic to anaerobic metabolism, causing lactic acidosis. Remember this very well. Why? Because lactic acid is produced due to low oxygen levels in the cells. Clear? Now it leads to intracellular potassium is released into circulation due to lactic acidosis. Then lysosomes from cell releases the blood, causing cell lysis. And hypoxia and acidosis through complements release free oxygen radicals, that is O2 plus, and cytokines, which does the capillary endothelium damages, and eventually cardiovascular, respiratory, renal, endocrine, and GIT will become the affecting. Hence, when there is a lactic acidosis, you can see that there is a K plus release, potassium release, and there is potassium release, it leads to cell lysis due to lysosomes. As there is a cell lysis, you can see there is a release of free radicals and cytokines, and it damages the endothelium, capillary endothelium, and it eventually leads to shock. This is the mechanism we study here. Clear? Now, what are the causes of shock? To which reason shock appears? First, we will study the cause of hypovolemic shock. First is due to reduction in total blood volume. The total blood volume is reduced. That is hypovolemic shock. Now, what is the reason? One is hemorrhage. It can be external from wounds or open fractures during the accidents. It can be the internal injury into spleen, liver, mesenteric or pelvis. Another reason is severe burn, which results in the loss of plasma, because during the burns there is a hemodynamic changes which reduces the plasma level, cardiac output, urine output in the condition of burn. Another is peritonitis, that is the inflammation of the lining of abdomen or intestinal obstruction, and vomiting and diarrhea of any cause. It can also lead to hypovolemic shock. If vomiting or diarrhea is more than 48 hours, keeps untreated then. Another is the cardiac causes, acute myocardial infarction or acute carditis, acute pulmonary embolism, where emboli blocks the pulmonary artery at the bifurcation where two arteries separate the major branches. So acute pulmonary embolism or drug induced DIC, and cardiac surgical conditions like valvular disease, congenital heart disease CHD, MI, myocarditis, pulmonary embolism. These all are the cardiac causes. And toxemia of any causes. Clear? That is blood poisoning by toxins from local bacterial infection, toxemia. Or cardiac pulmonary compression causes like cardiac tamponade due to collection of fluid into plus fluid in the pericardial space, which prevent the heart to expand, leading to shock because it disturbs the pumping of blood. Cardiac tamponade or trauma to heart injuries. Another is the type is septic shock. The cardiac causes were cariogenic shock. It is due to bacterial infections which release the toxins, leading to shock. 62% we have seen highest, or neurogenic. Next is neurogenic shock due to sudden anxious or painful stimuli causing several splanchnic vessel vasodilation. Here patient either goes for the cardiac arrest or dies, or recovers fully spontaneously. But in the spinal cord or anesthesia, spinal cord injury or anesthesia also can lead to the neurogenic shock. It is due to splanchnic vessel vasodilation. Next is anaphylactic shock due to type 1 hypersensitivity reaction, that is allergic shock. Next is respiratory causes. Atelectasis, that is a collapse of lung. Thoracic injuries, tension pneumothorax, and anesthetic complications. These all are the respiratory causes. And other causes are acute adrenal insufficiency, that is Addison's disease, or mixed edema. It is associated with the hypothyroidism when it is kept untreated. Now it is important pathophysiology of shock, how shock is there. Now see, any cause of shock, whether it is hypovolemic, cariogenic or neurogenic or septic, first it will lead to low cardiac output. As there is a low cardiac output, it will lead to vasoconstriction as a compensation, because there is a low cardiac output. So baroreceptor reflex will be there, which will increase the sympathetic activity. So it will lead to vasoconstriction. As a result of vasoconstriction, there will be to the vital organ, brain and kidney. So it will cause a vasoconstriction and tachycardia. As there is this, it will cause a dynamic circulation will increase, because the body will try to perfuse the vital organs. Then it will lead to tachypnea, that is severely rapid breathing, which will increase the oxygen saturation. Then the peripheral veins or the capacitant vessels, it will constrict the diverting blood from the splanchnic system towards the essential organs, because there is the low blood flow, and it will decrease the renal blood flow, hence GFR, therefore the urine output will be decreased. First cardiac output was decreased, now urine output is decreased. As the urine output is decreased, it will activate the RAS system, and hence the RAS system causes the further vasoconstriction and aldosterone release, and it causes the salt and water retention. This is the initial stage. Clear? Any doubt, then you can ask in the comment section. After this, the ADH, antidiuretic hormone, is released, and it causes the further concentration of the urine occurs due to ADH, because it reabsorbs. And when the shock persists, cardiac output is again falls. So the first one, cardiac output was falling, then the urine output was falling. In this between there was the step where there was a vasoconstriction, then the ADH was released, it concentrates the urine, and again the CO is fold. Then hypotension and tachycardia, which leads to poor perfusion of the coronaries. So then the coronaries, there will be the low blood flow, as it does the hypoxic metabolic acidosis. It increases the acid amount in the blood, and it releases the cardiac depressants. What are the cardiac depressants? It is the small peptides released by the pancreas, and it leads to the cardiac pump failure. And as there is a cardiac failure, again there is a condition hypoxia. As there is a hypoxia, there is a inability of oxygen. So from the aerobic, the transfer will be into anaerobic. Clear? And as there is an anaerobic metabolism, it will lead to the lactic acidosis, and it will do the cell wall or membrane damage. So from the low cardiac output, the condition will be hypoxia, where there will be the cardiac failure. As there is a cardiac failure, it will lead to hypoxia, and then from hypoxia, it will lead to lactic acidosis. The mechanism is so clear. And the last step of the pathophysiology, as the sodium and calcium enter the cell, there is a potassium. So NaK plus is there, but the potassium is the leaked outside. As there is a potassium leakage outside, it causes a hyperalkalemia. There is the increased potassium amount, hyponatremia, that is the low sodium amount in the blood, and hypocalcemia, low calcium amount. And hence intracellular lysosomes break down, releasing powerful enzyme which destroy the own cell. So the lysosomes release the cells, and it causes the sickle cell syndrome when there is a NaK plus disturbance, sickle cell syndrome. And the platelets are activated, forming small clots in many places, and it leads to disseminated intravascular coagulation. This is the important step, that is DIC. And the DIC is what? Abnormal clump of thickened blood clots from inside vessels. And these clots use up the blood clotting factor, which can lead to massive further bleeding. Clear? Another are the stages of shock. Now, how the shock is staged. First, factors like infection, trauma, burns, hemorrhage or hypovolemia, it causes the hypoxia. As there is a hypoxia, it causes SIRS, systemic inflammatory response syndrome. Is due to vasodilation, increased endothelial permeability, thrombosis or leukocyte migration or activation. These all are the factors included due to SIRS. And all this leads to altered cytokines level, abnormal nitric acid synthesis, abnormal arachidonic acid metabolism, neutrophil activation due to free radical production, and altered complement activation. And this leads to failure of localization of inflammation. So the healing process will be reduced, and it can lead to the reversible shock. Till here you can say that the shock can be reversible, but then it leads to microvascular occlusion, cellular dysfunction due to sick cell syndrome, Na plus K plus imbalance, and DIC and pump failure, and this can lead to MODS, that is multi-organ dysfunction syndrome, and this is a irreversible shock of lung, kidney, clotting factor or same. So this is the stages of shock. Now we will see how the shock affects the various organs. First is heart. There is a low perfusion, low venous return, hence it decreases the cardiac output. As the cardiac output is decreased, it leads to hypotension and tachycardia. Persistent shock causes hypoxia and release of myocardial depressant and causes DIC, cardiac damage. What is in the lung? It is the interstitial edema, decreased gaseous O2 CO2 exchange, hence pulmonary arteriovenous shunting is there. It can lead to rapid breathing, and it causes ARDS, that is acute respiratory distress symptoms and pulmonary edema. Clear? What are the metabolic changes? Shock leads to hypoxia, which activates anaerobic metabolism leading to lactic acidosis. We have already seen. An antidiuretic hormone is released, which does the reabsorption of water from the renal tubules. Hence, it concentrates the urine more. Another hormone like ACTH, prostaglandin, histamine, bradykinin, serotonin compensate the effect of shock to increase perfusion to vital organs like brain and lungs. It tries to give the blood. What are the cellular changes? Occurs in the persistent shock due to release of the lysosomal enzymes, which alter the cell membrane permeability, causing death, sickle cell syndrome. Again, we have seen in the mechanism pathogenesis, we have already seen this sickle cell syndrome. Sympathetic overactivity due to microcirculation leading to capillary dysfunction. And the brain perfusion occurs, which decreases the patient become drowsy, and brain is the last organ to get under perfused in the shock. Remember this. What are the effects in the kidney? GFR is already decreased due to RAS before RS, and tubular reabsorption of salt and water increases the compensatory response. But in severe cases, tubular necrosis leading to irreversible damage. During the irreversible shock, there is a tubular necrosis. What is effect in the blood? Alteration in the cellular component, including platelet. So the clotting will be altered. It will lead to disseminated intravascular coagulation, DIC, and further bleeding. And in the gastrointestinal tract, it will cause the mucosal ischemia, causing bleeding from GIT with the hematemesis and melena, that is vomiting blood, and aggravated by the DIC. Hepatic ischemia leads to increased enzyme levels. So this was all about today. In the next session, we will discuss the various type of shocks in a detailed manner. This was the basis of the shock. So do subscribe the channel. Thank you. Have a nice day.